Yes, my name is Dr. Atousa Mahdavi. I am a doctor of chiropractic, but have certifications in integrative medicine and functional medicine and Ayurvedic medicine. I'm also a Ayurvedic yoga therapist. I've been practicing for 30 years in Los Angeles and Orange County. I have been practicing functional medicine for 20 years and Ayurvedic medicine for 10 years, as well as yoga therapy for about the same time. So, functional medicine is the holistic approach that utilizes the Western medicine, the conventional medicine, science of pathology and diagnostics. But when it comes to treatments, it does only natural treatments such as supplements, vitamins, nutraceuticals, herbs, herbal compounds, and of course, different methods such as detoxifications, also using personalized dietary recommendations, lifestyle recommendations. So it's very holistic mind body spirit or mind body consciousness approach. And we do some laboratory testing. So a lot of the diagnostics aim at basically finding the cause of ailment, finding the root of the conditions that people are suffering from. And we do that through functional medicine blood analysis and interpretation, functional medicine genetic testing that basically looks for genetic mutations, which tells us what we need to do to enhance the body's detox pathways. It will also tell us, let's say, if we do an environmental toxin test. So we could test for 39 different environmental toxins, 29 different mycotoxins or mold. We can test for 20 heavy metals. So there are many advanced functional medicine testing that is not done in conventional medicine, and they are highly researched. Okay, so conventional medicine is very much aiming at the symptoms, like what kind of symptoms a patient has, and it doesn't address the cause of that symptom. But in functional medicine, Ayurvedic medicine, or holistic alternative medicine in general, we look at what is the cause of the condition and we try to eradicate the cause. But also, conventional medicine, it's a seeker approach. It's crisis management. You wait until you're sick or you're diagnosed with a condition and you're not feeling well at all, and then you go to a doctor and they manage your sickness or they manage your symptoms. So basically, it's crisis management. But holistic medicine, functional medicine, Ayurveda have a preventative approach. So they don't wait until you're really sick or diagnosed with a condition. They try to catch it early on when you don't have massive amounts of symptoms or really unwell. So it's preventative in nature, and it's wellness oriented. So we think about, what does it mean to be well? What does it mean to be healthy? And that's a body, mind, spirit, or consciousness approach. And so, what is your mindset? What is in your thought processes, in your mindset, that is not enhancing your health or well-being? So we address that. What is in the body? We address that. And when it comes to spirit or soul, you could also call it consciousness. You could think about, basically, do you have a higher purpose in life? Are you serving a higher purpose? Does your life have meaning? Does your life have a purpose? So this is one of the also main differences. So it's a holistic, the whole of you approach. So there are many advanced functional medicine laboratory testing, and they're all backed by research and very much evidence-based and very scientific. And so one is blood work, but this is a very complete blood analysis. It's not just a few things here, a few things there, just like a lot of the medical doctors do it because they don't have a choice because of insurance reimbursement. and what the insurance covers and what is medically necessary. But in functional medicine, there are at least 52 to 70 different biomarkers that we perform, and we interpret and analyze them differently than conventional medicine. So that's one test, which is blood work. Then there is a test for genetic mutations. So there is about 200 different genetic SNPs that we test for whether or not they're mutated. Because if they're mutated, then we could address it with nutraceuticals so that the body can function at an optimal. So that test for genetic toxins, we call it, because for the most part, we're addressing what genetic mutations you have that do not allow for proper detoxification. And detoxification is so important for optimal health. Then there is other ones for IBS, irritable bowel syndrome, which could, a lot of different digestive issues can fall under this category, and candida, because there is a big correlation between IBS and candida. So that's another test. Then there is test for organic acids. Organic acids basically tell us what nutrient deficiencies you have, what kind of final metabolites in the form of organic acids the body is producing, that tells us what are the deficiencies and functional depletions in the body that need correction. There are tests for mold and mycotoxins. Like I said, the mold is in the environment, is in food, and mold has been linked to many ailments in the body, including anxiety, including certain types of cancers and autoimmunity. So it's really important to test for mold. There are certain markers for inflammatory markers for gut inflammation. So there is another test for inflammatory bowel disease and gut microbiome. There is another test for food allergies. There is a lot that can be tested. So Ayurveda is a complete medicinal system that originated thousands of years ago from India. So we say it's the oldest medicinal system on the planet, and it actually has given rise to many other systems of medicine, for example, Chinese medicine. It was extracted, so Ayurvedic medicine principles were extracted from the same textbooks of yoga. These are textbooks that are from thousands of years ago. We call them the Vedantic texts. In general, there is 4 of them. And Ayurveda was extracted from 2 of these texts that are called Rig Veda and Atharva Veda. So these are the same texts of yoga, and Ayurveda was part of those texts. So because of that, we say Ayurveda is the sister science of yoga. So where yoga is the science of enlightenment and liberation, Ayurveda is the science of longevity and life, the knowledge of life. And so if you have aspirations for liberation and enlightenment, and also reaching your hierarchy in this life, or you have desires to accomplish in this life, goals and aspirations, you need to be healthy. You need to live in a healthy body and a healthy mind. And a lot of times accomplishing certain goals in life requires a long life as well. But if you're ill and you don't feel well, how would you accomplish those goals? So Ayurveda comes in to make sure that you live long and you live healthy, so you could accomplish those goals. So sister science of yoga, because it's coming from the same textbooks, and it is addressing the whole body, the whole person. So the whole person is body, mind, and consciousness or spirit. And so in that sense, it's also a very holistic approach. Addressing the body means addressing diet, nutrition, and toxicity in the body. So it also addresses toxicities in the body. Addressing the mind is what are your thoughts made of? What is your emotional tendency? Do you have a tendency towards more negative emotions, negative thoughts, or positive thoughts and positive emotions? Mindfulness, breath work, meditation, yoga is a part of Ayurveda as well. And also, your consciousness, your spirit is basically, do you have a higher purpose in life? Just like in holistic methodology of functional medicine, where we talk about, do you have a higher purpose in life? Do you serve a higher purpose beyond yourself? So Ayurveda also has the same thing. Do you have a higher purpose? Do you have meaning in life? So even if it's not about spirit or it's not about soul, but consciousness, and do you have aspirations for achieving your highest nature, your higher levels of consciousness?
How do you complement Ayurveda and functional medicine in your approach to treating chronic illness?
Yeah, so when it comes to combining or complementing one with the other, functional medicine looks at the person as an individual, as a unique individual. When it comes to their genetics, nutrigenomics, which means what is your dietary adaptation to food as it pertains to your ancestral diet. That's nutrigenomics. It also looks at your very unique a blood analysis and interpretation. So testing what is your unique physiological level and status. And again, nutrigenomics and blood types. So that's very individualized and personalized. Now, Ayurveda brings in a different aspect of individualization, and that's Ayurvedic constitution, which is based on the 5 elements. So it introduces a more subtle aspect of who you are, constitutionally speaking, and in that sense, it kind of fills the gap. So if you bring in functional medicine and you bring in Ayurveda, now your scope and vision of how you're looking at a person as a whole becomes really vast. So in general, I would say chronic conditions are best treated with functional medicine and Ayurveda. And these could be anything like diabetes, high blood pressure, high cholesterol, digestive issues, even autoimmune conditions such as Hashimoto's or lupus. A lot of autoimmune conditions actually benefit tremendously from functional medicine and Ayurveda. Anything that is degenerative in nature and chronic in nature, like different kinds of arthritis, which also some of them fall under autoimmunity, like for example, psoriatic arthritis, rheumatoid arthritis. I mentioned digestive issues. That also includes inflammatory bowel diseases like Crohn's, ulcerative colitis, diverticulitis, also inflammatory, irritable bowel disease, irritable bowel syndrome, so we have to cut that part, irritable bowel syndrome, and chronic constipation. It could be acid reflux or GERD as well. So yeah, like a lot of people come in and they don't even have like a label or a particular diagnosis, but they just don't feel well. They don't have energy, they have brain fog or lack of focus and concentration. So fibromyalgia falls under that. Chronic fatigue falls under the chronic ailments as well. ADD, ADHD, anxiety as well. So there are many things that we can help. Obviously, if someone needs an operation or surgery, or it's an acute condition, conventional medicine is best. Certain infections that need antibiotics, antivirals, etc., conventional medicine works really well. But for chronic, we see that throughout decades that we've seen that chronic ailment is on the rise. In the US alone, 70% of the population has at least 1 or 2 chronic ailments. So in type 2 diabetes, actually, not type 1, type 2 diabetes is generally caused by someone's lifestyle. So what is their diet looking like? What is their lifestyle looking like? Do they exercise? Are they on high carb diet? And so the approach for type 2 diabetes is addressing their diet, and it's addressing their lifestyle and daily routines, as well as toxicity. Because research shows that type 2 diabetes is also negatively impacted by heavy metals. So, for example, lead and cadmium, for example, if they block the receptor sites for insulin, and they do, if someone has high levels of lead and cadmium or mercury, if they have high levels of heavy metals, they go and block the receptor sites for insulin, so then insulin cannot attach to the receptor sites and allow glucose transport through the cell wall. And so what happens is people are insulin resistant, and their glucose keeps on circulating in the blood instead of going inside of the cell and be used for energy production. So if they are full of heavy metals, we need to detox them. And generally, diabetes also goes, for the most part, hand in hand with obesity. So that also is almost like a vicious cycle of the obesogens in the body, not allowing the glucose transport and causing insulin resistance and acting like a endocrine organ. And so therefore, by alleviating heavy metals and toxicity from their system, they eventually can shed on the weight, and when you lose weight, then your diabetes is better controlled. So, yes, because as we are exposed to more and more environmental toxins, heavy metals, and other toxins like mycotoxin, which is the same thing as mold, um, there are two factors that play in. One is the level of exposure to toxicity in the environment. Two, our body's ability to detox naturally. So if your exposure to environmental toxins is high and your body's capacity to detox is low, then that means eventually you're going to have symptoms, and that doesn't necessarily mean you're going to be diagnosed with a condition, but you're not going to feel well. You're not going to have enough energy. You may have skin rashes that are unexplained. You may have brain fog, attention deficit. So many autoimmunity even is caused by some of these things. So if your body doesn't have the capacity to detox naturally, and that could be due to the fact that you have certain genetic mutations that does not allow for phase 1 and phase 2 liver detox to take place, and therefore the toxins keep on accumulating and you can't get rid of them. So that's when a functional medicine testing for genetic mutations as it pertains to liver detoxification comes in. So we could see what is your capacity, your natural capacity to detox. If you have mutations, then we address it with nutraceuticals so that your body can make what is needed for the liver to detox. So that's one thing. If you can't detox naturally because you have genetic mutations, then that needs to be addressed. The other thing, we're constantly exposed to environmental toxins continuously. You could be getting them through food because you're not buying organic food, so it's full of pesticides, herbicides, glyphosate, or maybe you buy a genetically modified food. A lot of the fake meats have this in them. A lot of foods are processed, so they're full of preservatives, additives that actually are very toxic, and a lot of them are carcinogenic. And let's say food coloring. And so if you're continuously exposed, at some point your body gives up and can, even if it's not, doesn't have the genetic mutations, it's almost like a filter, a car filter that needs to be changed and cleansed from time to time. It's the same thing with the body's filters. You have to detox them and remove the toxic and enhance the body's ability to get rid of these toxic load in your body, so that those toxicities such as heavy metals are not basically replacing the other nutrients that are supposed to be attached to the receptor sites on the cell walls, because heavy metals, for example, would block that. Environmental toxins also increase your inflammatory processes. So suddenly your immune system is basically on override, and it causes the autoimmune conditions or hive-like symptoms or things like fibromyalgia or chronic fatigue. So it's important to detox precisely because our body at some point has enough oxidative stress and free radical formation that our toxic load is going to be higher than our capacity to detox. So therefore we need to detox and be active about it, proactive about it. So the way we detox, we could address your diet. So we would remove the items from your diet that come with a lot of toxic load. So we make sure that you're not buying food that is sprayed with herbicides or insecticides, for example. We make sure you're not eating processed foods because they're full of additives and preservatives. We make sure that you're not consuming a lot of food that contains mold. For example, a lot of grains have mold, coffee has mold, and certain fruits and vegetables can have high levels of mold. Dry fruits, for example, can have that. And so first we address your diet and eliminate certain things. Then we would address it with nutraceuticals. There are certain nutraceuticals that give your body, give your liver the nutrients that it needs. The best place or the best point to start is when they're not that sick yet, because we can prevent anything from happening. But obviously, a lot of the patients that come and seek my treatment have already been to medical doctors, and the medical doctors don't have any answer for them. And so definitely most of the patients come to me as the last resort. But the best model of medicine is when you start prevention. So you are still healthy. Maybe you have a couple of symptoms that are not very serious. And as a preventative measure, you go to a functional medicine expert or an Ayurvedic expert, and so they can address your diet and nutrition and your lifestyle. So it's in harmony with your nature. And that functional medicine can detect early on what are the deficiencies and depletions and can address it early on. But we don't live in a perfect system of medicine, and so most people seek out my help when they have given up on other doctors helping them. Yes. So yeah, so the passion comes from, sometimes you are born with certain tendencies and certain desires. And I found that as a child, when I was surrounded by grandparents, and they were old, obviously older, and I could see that they're limping or they're sort of weak, and or they're in bed, or like my grandmother had rheumatoid arthritis, and when we would go visit her or she would come visit with us and stay with us for some time, that she would be rubbing this ointment on herself, and I would talk to her, and I would actually had the desire to get the ointments from her and actually put it on her body to basically help her with her pain. So I realized at an early age that I didn't want people in pain, and I wanted to help them get out of pain. And as I grew older and went to college and discovered that I had a love for natural sciences, biology and physiology and chemistry and health related topics, and then also a natural tendency for the means of natural healing of the body. And I generally was personally not a fan of pharmaceuticals. So therefore, what led me and directed this passion towards functional medicine and Ayurveda and holistic medicine was basically the understanding that the body has the innate ability to heal itself when it is given the right environment and when it is given the right nutrients and what it needs. Because we have the biggest and the best pharmacy within us if we give it what it needs to produce the best drugs and the best medicines for us. But it requires guidance, it requires expert, and of course, integrative approach is the best. And sometimes you have to work with a conventional medicine doctor alongside of a conventional medicine doctor. And so, yes, I've always been passionate. This is my calling. This is not a work. This is not a job, but it's my calling. And alleviating the planet from chronic ailment is a dream, and bringing about a paradigm shift in our current system of healthcare, which is sicker, has been a dream for 30 years. And currently, we see that there is even a shift in the way that policymakers are looking at it. And so I'm hoping that I could be instrumental in that and creating this paradigm shift from a sicker model of medicine to a wellness model of medicine, which is holistic.